Hi, it's Ruth, and here is our workout for January for the mat back care level. We're going to start off lying down on our back with some rotations. Remember to make your neck comfortable, so if you do find that you need to pop a small pad underneath your head, then please use that. From our supine lying position, we'll set up so that our legs are adducted together, getting a nice connection between the feet, between the inner thighs, and just gently stretch the arms out to the sides. Allow you back a few moments just to get ready to become accustomed to the change in position. Take a soft breath in and engage your core. As you exhale, peel the pelvis, the soles of the feet off the mat, rotating the knees to the side. Inhale, draw them back to the centre. Exhale, repeat that, rotating to the opposite side. Inhaling, returning to centre. Maintain the legs adducted together, ensuring that the legs do not slide off each other, or your knees do not separate from each other. Pay particular attention to your feet. The soles of both of the feet should come off the mat. You'll be rolling towards the outside edge of the lower foot each time you rotate it over. Shoulder blades and head maintaining 3-point balance. So we're keeping our connection to the mat through the back of the skull and through our 2 shoulder blades, working in a smaller rotational movement compared to when we have our arms wide and we work as far as we can. Last time in each direction. And then when we come back to centre from the final one, let's separate the heels, the toes and the knees, go onto parallel legs, bring the arms down by the side. Soft breath in, press the shoulders back and down. As you exhale, tip the pelvis backwards. Inhale, rock the pelvis to neutral. We're performing our pelvic tilt. Exhaling to tip the pelvis backwards, flattening the lower back to the floor. Inhale, returning to neutral. It's a very gentle, controlled movement, like everything in our Pilates practice. And we're paying awareness to our body, to the bit of our body that we're moving, making sure that it feels comfortable, it feels okay. And if we do get any change in sensation, if we suddenly get an increase in pain in the area that we are moving, then that's our body's way of saying that that exercise just isn't right for us and we should not do it anymore. So if you do find that any exercise you're doing increases your pain, stop at once. Final time through. And then as we release out of that last one, we'll be moving on to our side for rotations. You may want to prop your head up with a slightly larger pad. We're looking for neutral spine inside lying. So we're lying right on the edge of our arm. We're bringing the feet and the knees forward, stretching the arms out. Most of that pad is behind our head. It's a long arm rotation. Knees and feet are fixed. Breath in, engage the core. Reach to the ceiling. Turning the head, look at the hand. Breath out to rotate. Rotating as far as you can keep your pelvis and your knees still. Hold the end point of the rotation, 3 breaths. Breathing in to stay. Breathing out to stay. Breathing in to stay. And breath out to return. Let's go again. Breath in, engage the core, reaching the arm. Looking at the hand, we breathe out, we rotate, and we hold it. Breath in. Breath out. Breath in and breath out to return. Breath in, engage the core, reach and rotate. Holding, breath in, breath out, breath in, exhale, return. As we work our sideline rotations, our pelvis is our fixed point, and that is the point we are rotating away from. Therefore, our pelvis and our lower legs should stay completely still. We're isolating that rotational movement into the torso. Twice more, breath in, engage and reach, looking at the arm, breath out, rotate, breathe in, hold, breathe out, hold, breath in, hold, and breath out, release. And last time, breath in, engage the core, reaching the arm, breath out, rotate, breathe in, hold, breathe out, hold, and breath in, hold, exhale, release. We're going to work some external hip rotation next. So let's just pop our arms across our chest. Aim to keep the inside edges of the feet connected together. Pelvis still. Opening and closing the knee. So we're externally rotating the leg in the hip socket. Pelvis stays still. Core muscles stay softly engaged. And the only bit that's moving on our body is this top leg. You'll feel the muscles around the hip working to raise the leg up. And you may feel the muscles on your inner thigh working to lower the leg down. Working 2 more repetitions. And final one. Stretch through the front of the thigh as you bring the leg back and perform pelvic tilt in side lying as you take your leg into your stretch. Tuck the tail and release. So you're tucking your imaginary tail between your legs, moving into posterior pelvic tilt and then out of it. You should feel that the stretch at the front of your thigh increases when you move in and into the tilt. Twice more, into the tilt and out of it, and last one, into the tilt and out. Releasing and moving onto our hands and knees. In our 4-point position, I'll set up as hands under shoulders, knees underneath hips. Our movement will be spine flexion into spine extension. That exercise is known as cat. We'll go again, spine flexion, spine extension. Our breath pattern goes very nicely with a breath out to flex, breath in to extend, breath out to flex, breath in to extend. 2 more cycles of cat. And last one. From the extended position, soften to neutral, raise one arm. We're going to thread the needle. So the arm we've raised is going to pass underneath our body. We bend the supporting elbow, stretch as far as we can with that hand along the floor, and then we reach it high again. Again, this is another rotational exercise, our needle thread. Little bit of weight bearing here going on through our arm and our shoulder. And you're passing that hand as far underneath the body as you are able to, as you thread the needle. Last time this side. Reverse it, weight bear through the other hand. So we raise and thread. Raise and thread. A nice dynamic rotational movement. Twice more on this side. And final one. Releasing. We can lie down on our tummy next. You may want to just cushion your forehead. And it's important that you stretch your arms out wide into a T position for this exercise. You'll be using your arms to push a little bit to get the movement and the rotation. So with our face down, head on the pad, you're going to raise one leg up and flex the foot. And then we're rotating and you're trying to touch that foot to the opposite side. and bring it back down. Your pelvis will peel completely off the mat when you do this rotation. It may feel a little bit tricky initially, and you will be aware of the movement into your spine here as you rotate. We'll make the next one the last one. And then when we come out of the rotation, you'll straighten that leg, bend the other leg. So your foot goes to the opposite side of your body as you rotate, taking it over and back. And it's almost as if you're trying to roll over onto your side. We'll make these our last two in this direction. And final one. Now we'll follow that with a stretch back into shell. You can use your seated slump stretch rather than a shell stretch if that works better for you. Try to sit your bottom right onto your heels. Get your chest as close to your thighs as you can. Tuck your head down and lengthen the arms forwards. Staying in that position, bring your awareness to your breath, especially the breath out, as you will be using that to try to relax your muscles into this position, blowing the tension away as you breathe out. Last cycle of breath in and out. Rolling up to kneeling. Now you can be in a low kneeling position or a high kneeling position for the next exercise. Arms are going to float up. We'll be squeezing shoulder blades together, separating apart, squeezing together and separating apart. So we've got adduction of the shoulder girdle or shoulder girdle retraction as we are pulling back, and then we're separating the shoulder blades or shoulder girdle protraction when you're reaching forwards. So exhale, squeeze back, inhale, release. Exhale, squeeze back, inhale, release. Exhale, squeeze back, inhale, release. Last time. Exhale, squeeze it back, inhale, release. Relax the arms. Come to 4 points, hands and knees, and see if you can do the same thing from here. So shoulder blades together, shoulder blades apart. Shoulder blades together, shoulder blades apart. Shoulder blades together, shoulder blades apart. Now you may find that if your wrists do not like this in a 4-point position, they'll tolerate doing the same movement but using the wall. So you can stand away from the wall, shoulder blades together, shoulder blades apart. And again, you may prefer this position if kneeling is an issue for you and you just need to take a little bit of pressure off your knees. We'll make this the last one, shoulder blades together, shoulder blades apart, and it's really important that the elbows stay straight when you do that, and then you will get your shoulder blades moving rather than your arms bending and straightening at the elbow. Moving to our opposite side, we'll balance rotations. I'm going to put my head at the opposite end of the mat. So we've got a right angle at the knee joint, a right angle at the hip joint. Spine is neutral in side line, so there's no pressure between the waist and the mat. The pressure should be on the arm and on the hip and the leg. Breath in, engage the core, reach to the ceiling. Breath out to rotate backwards, knees are staying together, pelvis stays still. We breathe in, hold. Breathe out, hold. Breathe in, hold. And breath out, release and return. Breath in, engage, reach, breath out, rotate. Hold the end point. Relax into it. Breath in. Breath out. Breath in. And breath out. Return. Engage. Reach and rotate. Breath in. Breath out. Breath in. Breath out. Return. Breathe in, engage, reach and rotate, holding it there. Now you'll probably notice that your range of movement is bigger compared to your first one at this point in the set. Last repetition on this side, breath in, engage the core, reach the arm, gazing at the hand, we rotate, breathe in, hold. Breathe out, hold. Breath in, hold. And breath out, release, crossing the arms over the chest. So externally rotating the hip, open and close the knee. Inside edges of the feet staying together. Pelvis staying still. Core muscles softly engaged all the time. Now this movement, if we lay on our back to do this, is knee drop. Because we're lying on our side, it's clam. And because you're lying on your side, then the muscles in the hip are having to work quite a bit harder. They're lifting the weight of this leg against gravity. Whereas when you're on your side, your leg's going out to the side, you're working across gravity rather than against it. Probably won't take too long before you start to feel the muscles in the hip working. We'll aim for 2 more repetitions. Last one, and then moving into side lying thigh stretch. And we're holding on to the ankle, we've brought the knee back, it's in a straight line to the hip. We pelvic tilt. Tuck, release, tuck, release. Release, tuck and release. Feeling that gentle increase in stretch as we go into our pelvic tilt. Making this the last one, please. And then when we release, we'll be moving on to our back. If you've had a big pad underneath your head, you can pop it between your knees. Working on full spine articulation by rolling segment by segment to the top of the bridge and then rolling segment by segment out of the bridge. With the breath pattern, we take a breath in, engage the core, breath out, we articulate the spine up to the top of the bridge, hold the top, breathe in to stay. Breath out to roll down. Breathe in, engage. Breath out, roll up. Breath in, stay. Breath out, roll down. Breathe in, engage. Breath out, roll up. Breath in, stay. Breath out, roll down. Breathe in, engage. Breath out, rolling up. Top of the bridge should be a straight line from the knee through the hip to the shoulder. Breath out, roll down. And you should be conscious of your buttocks working to keep you there. Last time through, breath in, engage. Exhale, articulate up. Inhale, hold. Exhale, rolling down. Cossack rotations, pelvis and spine in neutral, arms are crossed over. We're twisting upper body, so we're turning our head and lifting one shoulder blade off the mat as we roll to the side and then back to the centre. Rotate opposite side and back to the centre. Your pelvis and your 2 feet are your 3 points of balance with your Cossack rotations. So they are the areas that you are keeping still. They're your anchor points. as you rotate side to side. Now, if you prefer to do this as a seated rotation or a kneeling rotation, you absolutely can. So please don't feel that if this does not work for you lying down on your back, you need to stay there. Try it in kneeling, try it in seated. It will give you the same movement. However, gravity will be acting slightly differently, and that might make all the difference to you being able to tolerate the movement. We'll once more in each direction. And then when we finish that last one, we'll come to centre, release the arms. Focus is on shoulder girdle. We'll be moving the shoulder girdle up towards our ears as we breathe in, and then sliding the shoulder blades down the back, reaching the fingers towards the heels as we breathe out. Breathe in, raise the shoulder girdle. Breathe out, draw it down the back. Breathe in, raise the shoulder girdle. Breathe out, draw it down the back. Breathe in, raise the shoulder girdle. Breathe out, draw it down the back. Breathe in, raise the shoulder girdle. Breathe out, draw it down the back, and then let it relax. Mobilizing the vertebra in the neck, we're going to rock the head into chin tuck and rock the head out of chin tuck. When we perform our chin tuck movement, the back of the head stays in connection with the mat. We'll rock in and out of chin tuck twice more. And then we'll progress this, moving into chin tuck and then rotating our head, turning to the side. We're trying to press our ear to the mat. Rotate back to centre, release from tuck. Rock into chin tuck, opposite way. Rotate to the side. Return to centre, release from the tuck. We'll continue to work this alternating sides. Rotating. I would like you to notice how easy or how difficult it is on each side for you to get your ear down towards the mat. Notice what the muscles, what the joints in the neck feel like. And then if you find that you would prefer to work to one side all the time, so if you've got one side that's quite stiff, for me it is my left hand side. So you might find that you prefer just to work to your stiff side all the time. That is absolutely fine. We'll do a few more repetitions and I'm going to work to my stiff side all the time. So I will be turning my head this way and working on that stiff side. Trying to encourage those synovial joints between the vertebra in my neck, just to produce a little bit more fluid, making them a little easier to move, a little less stiff, so that reluctance to move decreases as they warm up. And that's definitely made a difference for me on my left side by working there. So hopefully, if you have one side of your neck that is stiff, you will achieve the same kind of feeling of just getting it to move and decreasing the stiffness that I have just done. We'll make that our last one. And we'll move to shoulders. Maintaining the pelvis and the spine in neutral. We'll breathe in to engage the core and then exhale. We'll take the arm over our head, which brings the shoulder joint into extension. Inhale, circle the arm to the side. Change to the opposite arm. Exhale, extend the arm, moving into that shoulder joint. Inhale, circle to the side. I'm just going to slide down my back. I don't have quite enough room to circle that way. So we extend it and circle, extend it and circle. A nice free-flowing movement. If it is difficult for you to get this straight arm over your head and to touch the floor behind you, then try making sure that you've actually got your shoulder blades pulled back and pulled down before you start to go into your arm movement. And that feeling of drawing the shoulder blades towards each other will change the position of your shoulder joint, so it'll bring it closer towards the floor, whereas when we don't draw the shoulder blades down like this, the shoulder joints are up a little bit higher, okay? So think about that. Try to open the chest, and it should give you a little bit more range of movement in terms of being able to get into that shoulder extension position with the arm. Last time to each side. Wonderfully done. Okay, we're moving off our back and we're moving on to our side. You do want to pop something underneath your head. Now we'll be side lying with legs straight and arms across our chest. You may find that you need to put one hand down, so you've got a point to push against, and that is absolutely fine. Legs glued together, and do try to get into a very, very straight line here. Look forwards rather than looking down, because if you do look down, it is going to round into the cervical vertebra in the neck. Take your focus to the bottom leg, and with your bottom leg, you are going to lift it up. Your top leg is going to be a weight on the bottom leg, so you've got to push the weight of the top leg up and then lower down. So push the weight of the top leg up, lower down. Push the weight of the top leg up, lower down. Push the weight of the top leg up, lower down. Push the weight of the top leg up, lower down. Push the weight of the top leg up, lower down, and this time we're going to hold it. So we push the weight of the top leg up and we hold it. Now we should still have our pressure on the outside of the pelvis here, on the shoulder here, but definitely not on the waist as we're holding this position. And the longer that we hold the legs in the air, you're going to be aware of the muscles here, the top of the waist into the back, working really hard to hold the weight of the legs in the air. So if you touch these muscles, you're going to feel them, they're going to be hard. Okay, and we'll hold it just 4, 3, 2, 1, and then we'll let them go. And if you touch those muscles now, they're going to be much, much softer. Okay, so that's the difference between muscles relaxed and then muscles working hard. So they will become much more firm when they're working hard. Bend your knees and push yourself up onto your elbow. Bringing the spine from a relaxed position into a straight position. A relaxed position into a straight position. So to do this, you've got to push pressure into this arm, and you're pushing down with your elbow into the mat to bring the spine from the relaxed position and then into the straight position. Relax, straighten, relax, straighten and hold. So holding the spine as straight as you can, scooping actively into the muscles. Now you may choose to keep the hip down, or you may choose to roll onto the knee, lifting the hip up and loading those muscles in the core a little bit more. You might also find that you want to reach the arm if you're loading and you have rolled onto the lower leg. We'll count this one down from 4, 3, 2, 1 before releasing it. Face down for the next exercise into a cobra extension. Positioning your feet towards the edges of the mat, so we've abducted the legs, and placing your hands just in front of the shoulders. Breathe in to engage the core, and then breathing out, articulate up, prop yourself up on your elbows. Reach the crown of the head towards the ceiling at the same time as drawing the shoulder blades down the back. Focus on the breath. allowing the muscles to relax into the extension. And release it down, placing hands underneath your forehead. Bring legs to parallel and tuck the toes under. Head goes onto the hands. We engage our core, and then we tighten our thighs and clench our buttocks, releasing them. Tighten the thighs, clench the buttocks. Now you'll notice that when you tighten your thighs, some part of the front of your thigh is going to lift away from the mat. And that will vary for all of us because we all have different amounts of padding on the front of our thighs, and we all have different degrees of movement at the hip joint as well. So if you've got quite a mobile hip joint, you might find that a lot of the front of your thigh comes off. But it's the pressure between the thighs and the legs. As long as that changes, then that is absolutely perfect with this exercise. So we tighten the thighs, clench the buttocks and release. Tighten the thighs, clench the buttocks and release. Tighten the thighs, clench the buttocks, releasing. Last time. Tighten the thighs, clench the buttocks and release. Tuck the toes the opposite way, take the legs wide and prop up one more time into that cobra extension. So you've got a straight line here, elbows to shoulders, crown of the head is reaching. Breathing to relax the muscles in the back into the cobra extension. And we'll release it down from there. Changing sides, I'll turn my back to you just for a moment or two. You're going to pop the pad underneath your head, roll over onto your side, legs are glued together, arms are across the chest, focus on the bottom leg, keep the spine as straight as you can, raise and lower, raise and lower, raise and lower, raise and lower. So you're pushing with the bottom leg, top leg is acting like a weight so that you can work the inner thigh, and when you're lifting the legs up, all of these muscles in your waist are working hard to raise the legs up. And if you touch those muscles in your waist, you will feel how they change. So they'll go from being soft and squishy to a little bit more firmer. Last time. And then we're going to hold this one. So we'll raise and hold, keeping the legs just in the air, keeping the tension into these muscles around our waist. So these are our internal obliques, our external obliques, our transverse abdominals as well, that are all active here when our legs are in the air. Holding for 4 more, 3 more, 2 more, last one before releasing down and bending the knees. We push ourselves up onto the elbow. We go from a relaxed spine to a straight spine. Relaxed spine and straight spine. Now we're getting some dynamic shoulder loading when we move from our relaxed spine to our straight spine when we're propped up in our side position. And if this is as much as you need to do, if you are managing a shoulder issue, then this is actually a really, really nice way to start to build strength. So just do as many as you need to. Take a break as and when you need to. Okay, we're going to hold the straight spine now. Core muscles engaged. You've got the option to stay here, reaching an arm, or load it by raising your pelvis off the floor, rolling forwards to the knee, front leg as you hold, and that will put a lot more load into not only the shoulder but also into the muscles of the core, because they'll be working here to keep the spine supported and straight. We'll count this down. 5, 4, 3, 2, 1, releasing. We'll be moving on to our back next. I'm just going to put the light on, that looks really dark. Oh, there we are. And on our back, we will work on our knee folds. So laying down, we're finding our neutral. 3 bones at the front of the pelvis should be roughly flat and level to each other. Do support your head and neck if you need to, and press your shoulders back and down. Arms are down by your sides. So single knee fold, we move from the hip joint, keeping the angle of the knee constant, to bring one leg up to tabletop and then take it down. So the tabletop position is the position when we have the knee directly above the hip joint, like so. So it's a nice straight line. Double knee fold brings one knee up and then the opposite knee up, so you end up with both legs at tabletop before releasing one leg down and then the opposite leg down. You then change your leading leg, so it's as if the hinge is here. This is the moving part. Everything else is really nice and static, nice and still. And you'll feel core muscles working as you're raising your legs. Now, if you're working single knee fold, I want you to keep right knee up. If you're working double knee fold, keep both knees up. Your exercise will be heel glide and return. And we'll do a set of 10 on the right leg. So this is the easier level that I'm showing you right now. This is the harder level. And this is harder because this leg, the non-moving leg, has to stay non-moving. Sometimes this non-moving leg will do this and it will come closer in towards you as that leg goes away to kind of counterbalance the weight of the leg. So I want you to notice if that non-moving leg is actually a non-moving leg or whether it's a moving non-moving leg. And if it's a moving non-moving leg, you're going to correct it and keep it really nice and still. Let's go for 2 more this side. Last one, and then we'll change legs, okay? So if you're here with double tabletop, your change is really easy. You're just going to do that, glide out and glide in. Whereas if you've been here, then your change is 1 leg down, 1 leg up, and then you're gliding out and gliding in. Now, the parallel thighs is pretty important, so you can use this thigh if you've been working with 1 foot on the floor as a guide for the angle that you are gliding your straight leg out to. And that's a 45-degree angle that you're gliding that leg out to. If you've been working from double tabletop, you can generally use your foot. So the angle of your foot will be roughly a 45-degree angle if you glide that leg out towards it. Last 2. And final one. We'll bring it back in, release the legs down, lengthen them, take the arms overhead so you're into full body stretch position. Circle the arms around and bring one thigh in towards the chest, tipping the pelvis backwards. Ensure that the straight leg stays straight, so you're pressing the back of the knee on the straight leg down towards the floor. You're also pressing your lumbar spine down towards the floor. Changing the position of the hands, we're going to place them down by our ankle and extend the leg at the knee. But again, we've kept the thigh close to the chest, so this is a bent knee. The stretch will be here into the belly of the hamstrings as we hold it. and then we release it. We'll change legs. So we bring the thigh in. We're compressing into the hip socket here as we draw the thigh in. And now we move our hands down towards our ankle. Keep the thigh close and extend the leg at the knee until the point that you can feel this stretch round into the belly of the hamstrings. Thigh still very, very close to the chest. Should feel uncomfortable with the stretch but not painful. And we release it. We glue the legs together for the next stretch, and we're going to use our arms and our legs going in opposite directions. So if we raise our arms, rotate both knees over to one side and both arms over to the opposite side. Relaxing into it as you breathe and hold it. You're turning your head away from your knees. Releasing through centre and reversing it. The hands go over one way, we turn our head, we're looking at the hands, and then we rotate the knees the opposite way, bringing awareness to our breath. We try to use our breathing to encourage our muscles to relax into the stretch. Last cycle of breath in and out. Releasing to centre. Set up figure of four stretch, placing one ankle on the opposite knee and raise the supporting leg. We can take one hand between the legs, one hand around the outside of the leg to hold that supporting leg, but do take the shoulders back and down if you are using your arms to support your leg, aiming to keep the chest open as we stretch into the hip. Releasing and switching legs. Once you've got hold of that leg, remember to relax those shoulders, relax the neck as you bring it into your stretch position. Releasing the leg. We're going to make our way through to seated. I'm going to roll to my side and push up. Stretching our neck. I'm going to come to kneeling because it just gives us a little bit more space. You may prefer to use a standing position rather than a kneeling position. Moving our head into chin retraction, we take our ear towards the shoulder. Now the stretch will be felt down into the neck on the long side. You can make this stretch more pronounced by loading and just using your own hand to apply a little bit of pressure into the head, increasing the stretch. With this stretch, it's important that when you come out of it, you unload, you lift your shoulder, and then you bring your head back up. We'll go the opposite way, so we do chin retraction, pulling our head back. We take the ear over towards the shoulder. Imagine this hand has got a heavy shopping bag into it. It draws it down. We can use this hand to apply a little bit more pressure, just deepening that stretch into those muscles. So we take the hand off, we lift the shoulder, and we bring the head up. Release the shoulders. Let's stretch into the upper back, linking your elbows, dropping your chin towards your chest and separating those shoulder blades to stretch into the upper back. Releasing and stretch the chest, link the fingers, draw the shoulders back, extend the arms away. Releasing the arms, step 1 foot forwards and go quite far forwards with the foot so you've got a nice big angle at your knee, and from here sway forwards and sway back. As you sway forwards, you're going to feel stretch into the hip here, running down into the thigh. Now if this knee's uncomfortable weight bearing, you can do the same movement but from here. But it does become a bit of a challenge for your balance. As you can see, I'm having to use my wall, my handy wall. So it's much more supported here to sway forwards and backwards. However, if your knee doesn't like it, then do just change it. Last time. And then when we sway back, let's change legs. So you've got a long step forward, a nice big open angle at the knee, and we sway forwards and sway back. So when you sway forward, your knee is pretty much going to end up directly up above your ankle. Stretches in this back hip here. Couple more times on this leg. Now this gives us a dynamic hip flex to stretch. Dynamic means we're moving into the stretch and then moving out of it. Come to seated, stretching our short adductors, the inner thigh, placing the feet together. You can either press your elbows onto your knees and try and push them down, or you may find that propping your hands up behind you allows you to lower those knees a little bit further. Just choose whichever of those methods gives you the better stretch. You're going to feel it quite high up towards the inner thigh. We'll aim for a long adductor stretch next, and for the long stretch we take the legs out nice and wide. You'll feel this across the knees as well as running up towards the groin area. So we sit tall and then we just try to lean into it. Now when you lean into it, I'm just going to turn to the side. I want you to avoid doing this, okay? So this is rounding your back. We don't want that. We want a lean into it. So you're trying to keep your back tall rather than rounding into your back. Think about pressing with the chest forwards, and as you do so, you'll feel a definite increase in stretch into the inner thigh. We'll hold it. And then we'll release it and bring the legs together. Place one hand in between the shoulder blades, press the forearm, the elbow, or if you're very flexible, you may find that you can do this interlinking of your fingers behind your back to stretch into the arm, and it should be this arm on this side that you feel the stretch into. Release the arm, change it over, opposite arm, same things, elbow, interlink fingers, do whatever works. Releasing. We're going to come to standing, using a lunge as a functional movement to get us to standing. So from kneeling, you place your preferred leg forwards, you tuck your toe on the back leg, and then you drive yourself up to standing. Once you have got yourself back up to standing, we'll just release the shoulders. Take a nice deep breath in and stretch it towards the ceiling. before releasing down. Fantastic. I hope you have enjoyed that session. It was quite a nice mobilising session, not too much strength work in there. So keep practicing that until the next instalment in Feb.